Now let's start with the third section of our lecture, preterm labor, in which we will discuss the different causes of the preterm labor. In this, we will talk about the cervical weakness and infection and how they can lead to the preterm labor, and also the effect of multiple pregnancy and uterine distension on the onset of preterm labor, and what are the influences of hemorrhage and maternal and fetal stress on the preterm labor. Now, the causes of preterm labor. The causes, we have hematogenous infections. Hematogenous infections are the infections that can spread to the bloodstream, and once in the bloodstream, then they can, through the blood, it is transferred to to the different parts of the body and leads to septicemia. So hematogenous infection can lead to preterm labor. Then we have iatrogenic infections, which are the infections induced by different procedures or different tests performed, like amniocentesis, can lead to infections that can cause preterm labor. Then the maternal stresses can lead to preterm labor. Fetal stress can lead to preterm labor if there is a poor biophysical profile, low APGAR score. All these are the conditions that can lead to fetal stress or fetal distress and can cause preterm labor. Then multiple pregnancy, uterine distension. Multiple pregnancies is one cause of uterine distension. So uterine distension, as a result, multiple pregnancy itself and causing uterine distension, both can cause preterm labor. Placental abruption. Abruptio placenta is the condition in which the separation of the placenta from the uterine wall, and there is a hemorrhage behind the in-between, and this can lead to preterm labor. Decidual hemorrhage. Decidual hemorrhage can also lead to preterm labor. And then we have ascending infections. Ascending infections are the infections that can ascend up from the cervix and infect the different parts of the reproductive organs and cause premature rupture of the membrane. Ascending infection. Then we have another condition, which is cervical weaknesses. Cervical weakness leads to early dilation of the cervix, and this can lead to preterm onset of the labor because of the inability of the cervix to hold the growing fetus. So all these are the different causes of onset of preterm labor. Then cervical weakness is painless premature cervical dilatation. If the cervix is weak, it can cause cervical dilation. The cervix is open, this is vagina. Cervix opens and begins to dilate, and it can cause premature onset of the labor. Infection, different infections, we can say, we talked that iatrogenic, like the procedure in which amniocentesis, in which amniotic fluid is removed to perform different tests on the amniotic fluid to find out some congenital or genetic abnormalities, and by doing this test, infection can be introduced into the uterus, into the cavity, and then it can cause onset of the labor, or ascending infections from the cervix can also cause onset of the labor, preterm onset of the labor. Chorioamnionitis is the infection which can occur as a result of amniocentesis. So this is iatrogenic introduction. If complete aseptic techniques are not used and in aseptic measures are not used, then iatrogenic infection can occur, in which we have chorioamnionitis, salpingitis, which is infection of the fallopian tube, villitis, infection of the villi, and then we have all these different infections that can progress or lead to preterm labor. Multiple pregnancy and uterine distension. If we have multiple pregnancy, this can lead to distension of the uterus, and there is increased, as a result of increased pressure on the different structures, cervix, membranes. This can lead to premature or preterm labor onset. So risk of preterm delivery rises with the fetal number. So if there is multiple pregnancy, we have uterine distension. This can lead to onset of labor. And then another reason for uterine distension might be polyhydramnion, in which amniotic fluid is present in excess amount, and this can cause distension of the uterus and early onset of the labor. Okay, so uterine Mullerian anomalies can also lead to the onset of preterm labor, because different shapes of the uterus make it very hard to keep the growing fetus, and it leads to the preterm onset of the labor. This is the picture of the normal uterus here. This is the normal uterus. Class 1 is uterine hypoplasia or agenesis. This normal uterus look like this. Then uterine hypoplasia means there is decreased growth of the uterus, and there is hypoplasia. Then we have in the class 2 unicornuate uterus. This is the single cornua of the uterus. So it's unicornuate uterus. Then in class 3 we have uterus diadelphys. You can see there are two separate partitions of the uterus. Bicornuate uterus. There are two cornua of the uterus. Septate uterus. There is a septum in the middle of the uterus. Then we have the arcuate uterus, and this is the uterus which is as a result of DES, diethyl stilbestrol. Some females use this drug during the pregnancy for abortion, and if it's not, abortion doesn't occur, this leads to the complication. This is the picture that occurs as a result of diethyl stilbestrol. So all these uterine abnormalities are due to abnormality of the fusion of the Mullerian duct during the embryonic period, and these all can lead to the onset of preterm labor. Then the hemorrhage, these are the hemorrhages that occur as a result of abruptio placenta. When the placenta is separated from the uterine wall, there is accumulation of blood behind the placenta and between the behind the placenta and in front of the uterus. So between the uterus and the placenta, there is hemorrhage or blood. Antepartum hemorrhage and placental abruption are the leading cause of preterm labor, and the effect of these hemorrhages is mainly due to the effect of thrombin on membrane strength. So as a result of hemorrhage, thrombin is produced, and this thrombin causes weakening of the membrane. As a result of the weakening of the membrane, there is early rupture, premature rupture of the membrane that can lead to onset of the labor. Then we have occurrence of infection in hematoma. If there is a hematoma, it can lead to infection also, and these infections, as we mentioned in detail before, can lead to the onset of preterm labor. So hemorrhage is another factor that can contribute to the early onset of the labor or preterm labor. Stress, maternal stresses can lead to the onset of the labor. I mentioned stresses can be of different nature. It can be stress, domestic stress. It can be the socioeconomic stress. It can be the stress of work, job, being pregnant, complications of the pregnancy. All these stresses or the sicknesses can lead to the preterm labor. So maternal or fetal stress can lead to the onset of labor, which is usually the preterm onset of the labor. So that was all about this section. Thank you for watching sqadia.com.